Hello everyone, how are you doing? Your doctor is here again today, Dr. Tinuade. So, today I want to talk about pelvic pain disorders in females now. And when we say pelvic pain disorders, it means that those things that can cause pain when a woman wants to have sex or when they are having sex. So I have two examples that I want to talk about, but I'm going to talk about one of them today, then the other one another time. So the first one is what we call dyspareunia, and it means painful sexual intercourse. Like when somebody is having sex and the sex is very painful. Actually, the symptom, what they feel, differs from one person to the other, and some people is just mild, and some is just a little bit, some is just so severe and they cannot just cope with that pain. And the other one is what we call vaginismus, and that is involuntary contraction of the vaginal muscles when people want to have sex. I'm talking about females now. So it's very difficult for them to have penetrative sex. So they have this vagina to be contracting, and it will be, it will tighten up. Very difficult. And it's not only during sex too. Even if they want to insert tampons, we use tampons for menstruation. So when they want to insert tampons too, they have that contraction. Or if somebody is about to touch that area, I mean the vaginal orifice, the opening to the vagina, if somebody wants to touch that too, they have that pain. Is there too. In fact, in the hospital, if you want to do pelvic examination for people with vaginismus, it's very difficult because they can't just stay put for you to examine them, because the vagina will start contracting, the fear will be there. So before I continue, have you subscribed to my channel on YouTube, Dr. Tinuade, talking about sexual transmitted infection? Please do so and leave your comments so that I will know how to improve on these videos. I'm on Facebook too, STI and Female Health Matters with Dr. Tinuade. Please share my videos, click love and like. I have another page on Facebook, Female and Adolescent Health with Dr. Tinuade. I'm on Instagram, just type my name, Ajani Tinuade. I'm on TikTok, just type my name, Ajani Tinuade. So now, let's go back to vaginismus. Before then, this video is for females generally, but if you're not married, don't say you want to dabble into having sex on things like that. If you're having sex and you're not married, that's illegal sex. That's illegal. And you are cheating yourself. And I've met young people not married, even old people not married, like, I cope. You can cope. That's why I always advise people, give your life to Christ. When you're a child of God, you have strength to do the right things. The strength is there. So don't go and be doing what you're not meant to do. So let's go back to vaginismus now. So we have two types. We have what we call primary. We have the one we call secondary. For the primary, that means that person have not even had sex in her life before, and she's afraid of having sex, penetrative sex now. Then we have the other one, which is secondary. That means that person have been having sex, but something happened to her. Maybe she had surgery, she had some things happen that just made penetrative sex now difficult, that her vagina will just tighten up. So we have so many reasons why people have them. Some of them are psychological, actually. And one of it is this image. The image that a child has about sex from young. Maybe the pictures they've painted, like all these things, like, oh, if you're a virgin, you want to have sex, it's so painful, like that. That can result in vaginismus, actually. Because the fear will be there, and psychologically, the vaginal floor will start, the muscles will start contracting, tightening up, difficult for a penis to enter. Or maybe an idea that a child has had about sex, or maybe a child has seen a father abusing a mother when it comes to sexual intercourse, maybe being violent and like that. So when a child sees that, I'm talking about a female child now, they can have that idea, and that can result in vaginismus. And this thing is very, sometimes when I just think about this thing, I feel sorry and I pity females, because females in this part of the world, we are not allowed to be expressive when it comes to sex. So people are suffering in silence. Couples married, because people with vaginismus, even when you want to do examination for them in the hospital, it's very difficult because they are just scared. And you see, a lot of people are like that. They don't enjoy their marriage. They don't enjoy their sexual life because of this condition that we're talking about. And it's like there's this stigma. Oh, especially females, you don't want to talk about it. You don't want people to know that this is happening to you, because it's also associated with so many things. So you don't want people to know your story. Please don't suffer in silence. So these things, all these psychological issues with people, and can be cured actually. So what I'm saying is, vaginismus is something that can be managed, and managed very well. So now, like I was trying to say, that the risk factor reasons why people have this vaginismus. Now, another one is, if somebody has an abusive partner, somebody that is maybe a husband, a partner that is like an animal on the bed, that's, when you want to have sex with that kind of person, it doesn't treat you like a princess. It's just like he feels, oh, is a sexual right. Let me just penetrate anyhow and just do whatever I like. That can also cause vaginismus in the other partner, the female partner, because there will be that fear of having sex. And people that have been abused before, raped, physical abuse, childhood abuse, violence, raping, and like that, those things can actually result in vaginismus. So many psychological issues are actually associated with vaginismus. And for some people, it's just maybe somebody that is going towards menopause, the estrogen, that hormone that helps to lubricate the vagina, is not there again. So the vagina can be dry, and when they want to have sex, it can just tighten up like that. And also some things that have been done to some people, they've had surgery in that area before, the vagina area, and that gave them some psychological, emotional issues. So those are things that can actually cause vaginismus, but it can be treated actually. And one of the things that we do is what we call desensitization, which you can do by yourself. It's just like, oh, you're afraid of having penetrative sex, so you can just start introducing yourself to it little by little and relax. Then you can go for therapy. You can go for therapy, sex education, because one of the things that even risk factors that people have said is lack of sex education. The right one for people that have had all these bad impressions about sex. So sex education, you go, then we have exercises that people can do that can help that area to relax your mind. There's another thing, we call it vaginal dilator. Some people, they use that too, is working. And if there are issues with the vagina too, those things can be treated. So don't suffer in silence. That's what I'm just saying. If you have that condition, oh, you cannot just have penetrative sex, you can't even use tampons, and the fear and the phobia is always there. I've seen couples that they've not given birth, and still they cannot have sex. Why? Because of vaginismus, fear of having sex. The vagina will just contract like that, and it's something that can be treated. So if you want to talk to me about this issue, you can contact me on my email at Dr. Tino Ade, talking about sexually transmitted infections 023@gmail.com. Let me say that again. Dr. Tino Ade, talking about sexually transmitted infections 023@gmail.com. Then I have a business line actually, which I'm going to read. Is 08111774239. I will say that again. 08111774239. So till another time, and I'm going to come again with an interesting topic. Bye.